Hello, I'm Dr. Grizelda Anguiano, pediatrician specializing in ADHD.
And I'm Dr. Julie Gilbreath, and I'm an internal medicine doctor specializing in ADHD care in adults. And together we work with individuals and families navigating ADHD.
We created this series because one of the biggest gaps we see, it's not just treatment, but it's understanding.
So today we're starting with the foundation, what ADHD actually is. If you are here, there's a reason. You may have just been diagnosed, or you're wondering if ADHD fits you or your child, or maybe you've been living with this for a long time but never really fully understood it. And what we want you to know is this is the starting point, because when you understand what's actually going on, everything else begins to make more sense.
After working with hundreds of patients, one of the biggest things we see is that ADHD is often misunderstood. It's frequently misdiagnosed and often confused with anxiety, depression, bipolar disorder, or just plain laziness. Many people are diagnosed late when their child is getting assessed, or they see something they identify with on TikTok, or just not at all, right? Just keep living. It affects millions. It affects 5 to 7% of children, and they say 2 to 5% of adults worldwide. And just in case you're wondering, you really do not outgrow it. We're going to be diving into that further on in further modules. And almost universally, people blame themselves long before they have ever understood or taken the time to understand their brain. You are not the problem. Your child is not the problem. The lack of information is.
So let's start here. ADHD is a brain-based condition. It affects how the brain develops and how it functions day to day. Specifically, it impacts attention, regulation, and follow through. And one of the most important things to understand is that this is not about intelligence and it is not about effort. People with ADHD are often trying very hard, and they're often very hard workers. Many have developed systems to function in life until these systems fail or you hit menopause.
So true. ADHD typically shows up in three main ways. First, inattention. This can look like difficulty focusing, staying organized, or remembering things. Second, hyperactivity. And this isn't always a physical thing. For many adults, it feels like an internal restlessness or like your brain is always on. Like, what next, right? There's that squirrel moment. And third, impulsivity, which can show up as acting quickly, speaking before thinking, or struggling to pause. And then, of course, the remorse comes in and just, when you pause. But not everyone has all of these qualities equally. I said qualities. Did you hear that? Yeah.
They are qualities.
Yes.
At the core of ADHD is something called executive function. This is your brain's management system. It's what helps you plan, organize, regulate emotions, and follow through on tasks. And in ADHD, the system is there, but it is inconsistent. It is not broken, not absent, just inconsistent, which is why some days things feel manageable.
And others no.
And in others, no. Yeah.
So from a brain perspective, ADHD involves differences in the key chemicals like dopamine, which we've definitely heard about, and norepinephrine. These are important for focus, for motivation, and reward. So this helps explain something many people experience, right? Wanting that quick fix of things. And you can focus really well when things are going well, and definitely when they're interesting. But it's really hard for us, and we tend to struggle with things that feel boring or repetitive. And again, this is not a willpower issue. It's how the brain is wired.
Or if the task seems very difficult, right? Like you mentioned, but also if it has many steps and you don't even know where to begin.
And one with ADHD and one with ADHD. We all present completely different.
ADHD is also highly genetic. In fact, about 70 to 80% of the risk of developing ADHD is inherited. It comes from your genes, runs in families. And many times, a parent starts to recognize their own symptoms when their child is being diagnosed.
Sound familiar?
Yes.
You may have heard the term ADD. That was used more commonly in the past, and today everything just falls under the same umbrella, and which is good because it definitely makes sense, right? But the different presentations, right? There's inattentive type, there's hyperactive, impulsive, and combined. Many adults especially identify with the inattentive type. Just as, yes, that's where it seems like it goes away, but does it?
Yes. One of the reasons ADHD is missed is because it doesn't look the same in everyone. Girls and women in particular are often underdiagnosed because their symptoms may be quieter. Daydreaming, overthinking, or internal overwhelm, twirling their hair. And high achieving individuals may compensate for years.
Huh?
Yes, I know, which can delay a diagnosis.
Speaking to late diagnosis women, highly achieving women. So again, ADHD is not just a childhood condition, but it's going to look different. I love that little picture. Instead of hyperactivity, it may show up as burnout, disorganization, emotional overwhelm. Definitely keeps on going.
There are a lot of misconceptions about ADHD. So let's be clear about what it is not. It is not laziness. It is not lack of discipline. It is not just anxiety or depression, even though other conditions can coexist. And it's not something people simply grow out of.
Many wish it. ADHD, as we've been saying, also rarely exists alone. Many individuals also experience anxiety, and that's a lot of times what brings us into the office, or thinking you have a heart attack. Depression or sleep challenges of so many different types, not only insomnia, but so many different types. And all of this overlaps, right? It's one of the reasons that ADHD can be missed or misunderstood. And the importance of looking at the whole person, and a lot of times the whole family, is really important. We get to play detective and really figure out what's going on and how we can totally support the patient.
Exactly. What we want you to take from today is that ADHD is real. It's not a fad. It's not made up. It is understood. It has been studied for many decades. It is manageable. We have tools nowadays that we can use to make things better. This is not the end of the story. It is the beginning of understanding your brain.
Woo!
So why does it all matter? Because understanding ADHD changes how you see yourself. It helps reduce self-blame, and it gives you a framework for what actually works. And in the next modules, we will walk you through what actually helps.